Well, thank you, and welcome back to American Medicine Today. I'm with my friends Ethan Euchre and Dr. Bonati. Now, many Americans don't realize how much of our drugs and pharmaceuticals are manufactured overseas, particularly in China. And our next guest says that needs to change. Joining us to discuss is Dr. Sal Giorgianni Jr., Senior Science Advisor to the Men's Health Network. Thank you for being with us again, Dr. Sal.
Thank you for having me back on the show, Kimberly.
Now, Dr. Sal, if you could just tell us straight off the bat, how much do Americans rely on geopolitical rivals such as China for our medical supplies?
Much too much. I don't know that anybody's actually quantitated it, but if you look at as you say, the generic medication supply products coming from India, China, former Soviet Republic states, Latin America, they are probably the vast majority of the medications that people in this country take and ingest. These are countries where, in some cases, you wouldn't even want to drink the water. Why would we want to be taking medications that are made in these countries?
Well, absolutely. And why can't we just shift the manufacturing back here to the United States? I guess I don't understand that. Why do we have to rely on them?
This has been slowly evolving over 25, 30 years as the pressure to put and make medications commodity products has been placed on the system by insurance companies, third-party payers. It also has been forced down people's throats with pharmacy benefit management companies, the PBMs, who manage the contracts on almost 95% of the medications people take throughout the U.S.
How long do you think it's going to take to bring these companies back and reestablish our supply in the country? Because this dependency is not only dangerous, but at the same time, the products are not at the level that we need, and the complications and problems that happen from those products sometimes are deadly.
Well, that's a very astute observation, Dr. Bonati. And the estimates that I'm seeing from industry folks, analysts primarily, is it's about 10 years, so it's before 2031, before we can really correct this problem fully. Now, in 5 years, perhaps, we can make a big dent. And the problem there is that you just can't stop production on every production line in the U.S. and EU to immediately go to manufacture all these other products, and it's not that easy to get through regulatory approval. So it's a rather difficult process, and it's going to be very time-consuming to do.
It's unbelievable the opportunity that will appear for a population of kids today, because in 10 years from now, is that type of a field is something that will be not only individuals that they are going to be paid very well, but they are scientists. And then the education and the opportunities and the importance of bringing these medications to the country are so enormous. Just only to look at how we can help the work conditions on people and create other different jobs is very exciting.
Yes, and that's one of the subtleties and why it takes so long is there's not a lot of qualified chemical engineers and plant engineers coming out of the educational system in the U.S. They have a tendency to come from the countries where we see these plants popping up like mushrooms. And you bring up another good point, that the medications, it's not just that they're full of toxins, as we've seen with metformin, Valsart, Zantac, some of the other medications that have been genericized and had quality problems, contamination problems, but also in some of the treatment failures that we see in patients who should be getting better, and may also be due in part to the quality of the medications not being where it should be. And U.S. manufacturers have created their own subsidiary, non-branded or generic lines, just like Toyota has its lines of upscale and downscale cars, but they still conform to European Union quality standards. And probably most physicians don't know that patients have the absolute right to go into most any pharmacy except for these closed-door pharmacies and request a specific U.S. brand or innovative brand pharmaceutical company generic. And then the copay is the copay is the copay.
They have the right to request them, but I've had the personal experience that when you ask for something, they don't always give it to you. So you have the right to ask, but you're not always given what you ask for.
You're absolutely right, Kimberly. It depends on the plan. I, myself, go to a closed-door pharmacy, so I can't get any particular brand. But for the majority, public's policy is if the patient wants Greenstone brand, they get Greenstone brand. If patient wants one of the other main company generic lines, they request it. So, it also depends on what pharmacies you go to and what your plan says.
Absolutely. Well, unfortunately, we're out of time. Thank you so much for discussing such an important topic. Dr. Salvatore Giorgianni Jr., Senior Science Advisor to the Men's Health Network. Thank you for being on the program.
Thank you. My pleasure.
And take care.
Thanks, Doc.
Thank you, Sal.
Make sure you check us out again next week on American Medicine Today.